Welcome everyone to Wellness Wednesday with New Mount Calvary. Once again, we have our special guest doctor in here,
What's up,
Dr.
people?
Charmille Hare. I wanted to say thank you to Dr. Hare for the last couple of discussions that we've had on diabetes and high blood pressure. When I tell y'all that was some wonderful information, I hope and pray that you guys took that information and actually used it to your benefit. So once again, thank you, Dr. Hare, for
Yes,
the last
ma'am.
couple of topics. Now we're going to talk about some more stuff.
Absolutely.
So you guys get your little paper and pencil together so you can take some notes.
Let's go, people.
So here we go. So today, Dr. Hare and I will be discussing what is a physical. When you say I'm going to the doctor to get a physical, or if your insurance company say it's time for your physical, Dr. Hare, exactly what does that mean? And can you kind of tell us the difference between a physical for a man and a physical for a woman?
Okay. Well, really, the part of primary care that is the most important is the point of prevention. My job as a primary care doctor is to try to prevent disease. So how do we prevent disease if we don't know the disease is there? So the whole purpose of an annual physical is to literally evaluate you as much as possible from the top of your head down to your feet and internally as well. And so when we do a physical, the purpose is to screen for disease. We're trying to find diseases. Now, some patients get frustrated because they want to come and do their physical and talk about their blood pressure and talk about this and that. Oh, I have a scratch, I have an itch. That's not the purpose of a physical. The purpose is not of a physical to come and get as much stuff as you can get done free. That's not the purpose of a physical. Then you're missing out on the opportunity that a physical is. The purpose of a physical is to screen for as many diseases as possible. And if we can catch these things early, we can treat them early and prevent any possible complications. Now, we have a man who comes in for a physical. We'll talk about depending on age. So if a man is going to come in for a physical, we're going to do this similar things that we do to a woman. The first thing we're going to do is ask about your family history, ask about your medical history, ask about any surgeries you've had, ask about the medications you're taking daily. After we do that, then we're going to ask if you're having any concerns as far as just in your general health. And we'll discuss that a little bit. After we've done that, then what I do for a man is I'll do a physical. So I'll check your ears, your nose, your throat, your heart, your lungs, your belly, check for swelling in your legs, check your pulse, check your muscle strength in your body. When I've done that exam, then I now have to evaluate what's going on inside your body. And we do that by blood work. I need to know what your blood cells look like. I need to know what how your kidneys are functioning, how your liver is functioning. I need to know your cholesterol. I need to know if your thyroid is functioning properly. I need to know if you have any vitamin deficiencies, typically vitamin D and B12 we check for. For some men, if they're over a certain age, typically over 40, over 50, they may be curious to know if their testosterone is within normal range. We can sometimes do that in a physical and insurance cover it. If there's family history of heart disease, sometimes we can get insurance to cover having an EKG, so we have something to compare to. Typically, when a patient's having a heart attack, we don't have an old EKG to compare to. We can't tell when something's changed. And so if you go and get your physical and we have a primary EKG, then we have something to compare to. For men over a certain age, typically between the age of 40 and 50, depending on your race, men of color have a higher risk of getting prostate cancer at a younger age. And so we start screening for prostate cancer. So we do special tests, blood work for it, but we also need to do what we call DRE, a direct rectal examination, to actually take a look at the prostate. And I can't tell you how many men avoid me just because they don't want to get that prostate exam done. Yes. They don't want that test, but it's so important. We don't want to have complications from the prostate. We're not just screening for prostate cancer. We're screening for the size of the prostate. So many men don't realize they don't sleep well at night is because they have to go to pee 4 or 5 times at night. And something as simple as a DRE can tell me, oh, you have an enlarged prostate. There's some herbs that you can take. There's prescription medicine you can take to shrink the prostate so you don't have to be miserable all night.
Well, question, Dr. Midnight. I'm not Dr. Hare. Sorry, y'all. I was thinking about my other doctor, Jesus. Dr. Hare, before you continue, you're saying DRE, but for those who don't know what DRE means, can you tell them what DRE is?
It's a direct rectal examination. The prostate is located in the middle of the pelvis, and there's no other way to get to it. I don't want to have to do a direct rectal exam on men, but there's no other way for me to feel the size of the prostate, whether it feels that there's a mass on the prostate, whether it feels like it could be infected, but through a direct rectal examination. And so for a lot of men to have a direct rectal examination is very uncomfortable. However, there's no other way to screen. I have men say all the time, well, just do the PSA, which is the blood test to check your prostate specific antigen. We're looking for any evidence that your prostate could have cancer. And a certain number we look at, if it's above 4, you could have prostate cancer. The problem with that is the PSA is not a perfect test. There are patients who have infection of the prostate and their PSA is very high. And then you have people who have low PSAs who have prostate cancer. So the problem is it has too high of a false positive or false negative to just do it by itself. You need the PSA with the DRE. Those two in combination give us a better picture of what's going on with your prostate. And then also men over a certain age, men and women over a certain age, at the age of 50, we do colonoscopies. So we usually will refer you to do a colonoscopy, or you need to have colon screening. It can be done via colonoscopy, which is the best. The gold standard is a colonoscopy. If it's clear, you don't have to do anything for 10 years. The second test is the Cologuard. They send a kit to your house. They check your stool for blood and DNA that looks for cancer. That will last 3 years if it's negative. FIT test, or we call home blood test, we're looking for just blood. That lasts about a year, but you need to screen your colon for the risk of colon cancer. So that's the other thing we do after the age of 50. And of course, then we're looking at immunizations. As patients get older, there are shots that they need to get, and they're all hesitant to get them done. But shingles is a real condition that happens for patients over the age of 55, really actually over the age of 50. Some people even younger. And so because of that, we offer the shingles vaccine to people over a certain age. Tetanus shot is supposed to be renewed every 10 years. If you have any chronic health conditions, you may need to get a pneumonia shot, flu shot. So all these things we do in a physical. You don't get a physical, you miss out on all of that.
Mm. And before we go to the next thing, so flu shot.
Yes.
I know we're not in that season right now, but when it comes to flu shot, everybody has their opinion on a flu shot.
Yes.
As a physician, what is your take on that? Because a lot of people say, I don't get a flu shot because the last time I got a flu shot, I was sick as I don't know what. I got flu. So what's your take on it as a physician?
Well, if you look at the information as far as side effects from vaccines, they can cause a slight reaction in your body. That's not unusual. And we have a whole list of all the side effects. When we give patients a shot, we literally give them a printout of all the information of what they could see with that. Have patients had mild rhinitis or mild discomfort, not even mild fever, just not feeling well for a day or so after having a shot? Absolutely. We're trying to trigger your immune system to work with your body so that if this flu shows up in the body, it will react properly and prevent you from getting very sick. If I had to weigh the side effect of the flu and the flu, I'll take that side effect. There's no way that I can guarantee to a patient that you'll not have a side effect from anything. You can have a side effect from water if you drink too much of it. The side effect, you're going to pee a lot. So there's side effects to everything. Yes, we can't live in a side effect free world. Any decision you make, there is a consequence to go with it. However, with the flu shot, every decision we make in medicine is risk versus benefit. If the risk outweighs the benefit, don't do it. But if the benefit outweighs the risk, do it. And in the case of flu, the risk of not getting it is much higher. There are too many complications from flu. Pneumonia, sinusitis, bronchitis, be sick out of work for at least 2 weeks. It's miserable. And if you don't catch it within the first 72 hours to be treated with Tamiflu, you're going to be sick for at least 2 weeks.
Exactly.
Yeah. So that's how I feel about vaccines. It's a risk and benefit ratio. It's not about, oh, you take this vaccine, you'll be fine. I think doctors, we say that just because we don't want to hear all the stories that your mom and them told you about that flu shot that are wrong. They're not right. These are anecdotal, or what we call people's stories of what they've experienced. It doesn't mean that's going to be what happens to you. And this is why you have a primary care doctor. If you have a primary care doctor and something happens, we record that, we keep a record of it, so we know, okay, this person can't have a flu shot. Do you understand my point? So I don't think avoidance, nothing wrong. At the end of the day, being healthy is a good thing no matter what. But there are other things that we do to help eradicate disease. There are diseases that we do not see anymore because we get vaccines. Right. We barely see chickenpox. We barely see measles, mumps, rubella. We barely see polio. We don't see those things because we have vaccinated against them. Correct. So I didn't talk about a woman. Do you want me to do that, yes. Lakeitha? Yes. So when we're talking about women's physicals, they're a little different because, women have different parts than men. So some of the things are the same. You're going to come in, we're going to go over your family history. We're going to do the same blood work. There are going to be some added bonuses that we can do in that blood work. Vitamin D is a big deal for women. Vitamin D deficiency can cause lack of bone density as we age, especially in women, and we go through menopause. There's risk of decreasing bone density. And so it's very important to check your vitamin D before you get to that point so that we know if you have a tendency towards being deficient, we can start putting you on the appropriate medication and preventing you from having bone loss at some point in an older age. So that's number one. We also do breast screening. And so mammogram is really important. We can actually do a breast exam in your physical, and that's still included in the physical. We can do EKGs on women as well. We can do blood tests to see if you're menopausal, perimenopausal. That can also be added to your lab profile. A lot of women end up having thyroid issues. We screen for thyroid issues when you're doing your physical. The other thing that we can actually do as part of your physical is an actual Pap smear. So a lot of women go to their OBGYN and get their Pap done here and then come to their regular doctor for this. Well, I'll go to my regular doctor for my blood pressure and stuff. But I'll go to my OBGYN for this and that. The problem with that sometimes is that lines get skewed. So I'm going to go to the OBGYN to do my Pap, but I've not had screening blood work in 2 years because I go to my OBGYN to just get my Pap smear. So I've done my physical, and that's not true. Right. You've missed out on all the labs that'll help us to know what's going on in your body. So we're not getting the full benefit of an exam if you're only doing a part of it. Now, some OBGYNs will check your blood count, will check your cholesterol, will check certain things. And some of them are very thorough. They'll check thyroid, they'll check all your hormones. And so if you have that type of OBGYN, you can do your Pap and get all that done at the same time, by all means do that. But if you don't have that type of OBGYN, sometimes it's better to go to your family practitioner and have everything done in one place. Yes.
That's good. Mm-hmm. That's good. So now that you've told us what we can look forward to when we go for our physical, tell me, how often should someone have a physical?
I recommend a physical at least once a year. It's so important. You'd be amazed what changes in a year. We age every year, so if every year there's a change in your number, there's going to be a change in your body. There's certain milestones, even in age, that we see different things. We need to do different tests. We need to do different screening exams. We need to do mammograms at age 40. We need to do colonoscopies at age 50. And so I think it's really important to do a once a year exam. The issue we have sometimes with physicals is we don't start seeing patients for physicals until they're well into their 40s. And really, you should be doing physicals in your 20s. From as soon as you leave your mama's house at 18, you should be doing a physical every year. Mm-hmm. Really, because if we can catch stuff early, by the time in your 40s, you're not going to be struggling. So what I tend to find is everybody's scared to go to the doctor. Then you say, well, I'm getting older. I need to go and get a physical. Now I have to diagnose you with 4 diseases. Correct. In a physical because you haven't been to a physical in 10, 15 years. Correct. Have you had those conditions for a long time? Most likely. But now you're overwhelmed by all these diagnoses. Oh my gosh, I have this and I have that. Well, you probably had it already. But because it's been so long since you had a physical, you didn't know that. So I think it's really important that, young people, even young people who are relatively healthy, it's still important to do a screening exam every year. Catch these diseases early, because a lot of things are preventable. Some of these things don't require medication. Some of them just require diet and exercise changes. If you know that your blood sugar is bordering on high, okay, I need to cut back the sugar. I need to cut back the soda. I need to exercise. I need to build muscle mass. I need to cut out that fried food. How do you know that if we don't screen your body? So that's the purpose. A lot of times these things are treatable. And when you're young and you're pretty healthy, there's a lot of things you can do. Even if you're older, there are a lot of things that you can do to prevent these diseases early on. The longer you wait for physical, the longer it takes for us to catch these things. And the more likely you're already advanced in the disease. There's nothing we can do to reverse it.
Mm-hmm. So in summary, if you had to, if you had to tell someone today, just in summary, the importance, like the biggest thing, the most important thing about a physical, what would it be?
Oh gosh, that's a heavy question. There's so many important things, but the purpose of a physical is to screen and prevent disease. If you get your physical every year, we can screen and hopefully prevent disease. You don't get that physical, I cannot guarantee that.
Okay, that sounds good to
Yep.
me.
Yes, ma'am.
So you guys, you've heard it. If you have not seen a doctor in 3 months, 6 months,
Yes.
or a year, if you haven't had an actual physical in a year, you need to be making an appointment. Don't wait until you get sick and then
Correct.
say, well, I'm going to go for my sick visit, but then have a physical at the same time. No, it don't work like that.
Yes.
It don't work
Absolutely.
like that. It's a whole lot to go into this thing.
Yes.
So
Yes.
billing and all that.
Yes.
So that's
Exactly.
a whole nother thing.
That's a whole nother
But
discussion.
anyway,
That's right.
Yeah. So if you have not been seen by a doctor within the last 3-6 months, then please see your doctor. If you don't have a doctor, Dr. Hare is accepting new patients.
Yes, I am.
Dr. Hare, give your contact information.
So my number is 770-898-4339. You can go to www.piedmont.org and put my name in there when you're searching physicians, Hare, Hare, and you can also book online as well. And we're located in Locust Grove.
Hey, you can go to the doctor.
Yes.
Then you can go shopping.
Yes.
And hey, all is well with the world. So once again, guys, I want to say thank you to Dr. Hare for her time and for her wisdom that she's sharing with us these last few weeks. And once again, this is Lakeitha with Wellness Wednesday with New Mount Calvary. We thank you guys for joining us once again, and we hope you have a great day and take this information.
Yes.
Get your physical.
Yes, get your physical.
Thank you, Dr. Hare.
You're welcome, guys.